Hey guys, it's Dr. Mark, and I wanted to talk to you guys a little bit about sleeping posture. I know that over the last couple days, I've had a couple patients say to me, "Hey, Dr. Mark, I'm waking up, with neck pain, or I'm waking up with back pain." And typically, when I hear that, I usually look at three things. I look at your sleeping position. I talk about and ask about your pillow and maybe even your bed. So when I look at first sleeping position, oftentimes we have to look at, how many pillows are you sleeping on? What position are you sleeping in? So if you're sleeping on your side, typically you want to be able to have, that space between your shoulder that's contacting the bed and your head as neutral as possible. So fill in that gap. So if you have two pillows, sometimes what ends up happening is your head gets, bent to the side. If it's too thin, sometimes what happens is it caves in, and you can imagine, over a course of 6 to 8 hours, it puts stresses on your neck. When we look at sleeping on your back, generally speaking, the thinner the pillow, the better. Because if your pillow is too thick or you have multiple pillows, it just juts your head forward, really puts stress on the neck and the upper back. And it's just like sitting down for hours on end. So it's not a good thing. So the thinner the better. And for some of my patients, they find relief when they don't have a pillow. Okay, so really look at that. When we look at your bed, I always say whatever is comfortable for you. Research shows that medium to firm is probably the best. Generally they say replacing your mattress over the course of 10 years. So if it's an old mattress, if it's been there for a while, obviously it might be time to be looking into that. I don't generally recommend anything specific. I always say when you're looking at beds, you have to lie on it. You don't have to spend $3,000 on a mattress, but look for something that you're comfortable in. And lastly, it's looking at your pillow. And I always say too, don't necessarily fall into the trap of, the $100 pillow. We do have pillows at the office, and we have them there just as something to help you out in case you can't find the right pillow. But the biggest thing is just finding a pillow that suits you. And so experiment with the pillows you have. Steal your husband's pillow, steal your wife's pillow, and maybe just mix it up and see. You don't need that expensive pillow, but really the key is making sure that you're in neutral posture, so your head isn't tilted off to the side. That's one of the biggest things. And lastly, I think most people know this, but some people don't. It's making sure that you're sleeping on your side or on your back, and not sleeping on your stomach. So imagine if you're sleeping on your stomach, what ends up happening is you're turning your head, you're torquing your neck, and then what ends up happening as well, okay, is that generally people at the front have a little bit more in the belly, and it hyperextends their lower back. So I always tell patients, if you're sleeping on your stomach, it's not a great idea. Try to really work on sleeping on your side or on your back. Okay, so if there's any more questions on that, let me know on the comment section, and I can answer any of the questions you may have. All right, have a great day.